Ladies and gentlemen, welcome back to Your Health Unplugged. Today, we have a very special guest here. This is Zachary Perdue from Perdue's Perspective, and we're here to talk about healthcare and the economics of healthcare and probably the bullshit of healthcare and the way the systems work. And it's going to be a great show for you guys today, and I hope you're excited for this. We'll talk for about 30 to 40 minutes or so, and then folks can drop some questions in the chats and we'll answer those at the end if we have any. But at any rate, welcome, Zach. Tell us a little about yourself.
Thank you for introducing me, Alan. I appreciate it a lot. And I'm excited to do this today. Personally, I'm a graduate of York University, a big institution here in Toronto, Ontario. And for the recent, probably last month or so, I've been starting to do a political commentary channel really covering Canadian issues because I think there's a lot of things going on in Canada right now. We both from the inside and from people on the outside looking in, especially Americans, your neighbors to the north, they're wondering what the hell is going on up here. And so I want to try and cover a lot of those issues and explain what exactly is happening, because I think a lot of people are just getting a lot of mistruths or a lot of lies by omission, unfortunately, with what's typically reported. And so that's why I thought today's episode would be a really good one for a lot of Canadians who have a lot of misconceptions regarding how American healthcare works. They think it's purely a private system, in which it's not. It's this mixed bag of problems. And I also think for a lot of your audience, the Americans looking at us up north, they can get an idea of what it's like for a socialist healthcare system that we've had for a long time here and how it's expanded into many sectors and grown more and more. I think there's a lot of misconceptions there that need to be straightened out. So there'll be a lot to talk about. I'm excited.
Yeah, if you guys can't tell from Zach's accent, he is Canadian, so that's going to be the key point here. That we're going to talk about the differences between both systems. So I'll preface with the American system in twofold. Number one, believe it or not, when I went through training, medical school, and residency as a physician in training, we got taught about billing and Medicare, Medicaid, and insurance. Like I think I may have like a half a lecture in medical school. And then if I was lucky, an attending talked about billing with me just out of nowhere. It wasn't really formally taught to us, nor it was tested. So many doctors coming out of training, they have absolutely no idea what the hell they're billing. They were told to do certain things by certain administrators to bill a certain way. And we just did it, and we ended up focusing more on doing doctor work, which makes sense because that's what we're there to do. But it became a whole separate process, and sometimes the doctors forget, like, the patients get billed after you try to save their lives. And then the second thing also is that healthcare in general is just monstrously complex. Like, we all like to have these like one-stop solutions of like, hey, we could solve healthcare by making X cheaper or not getting this party involved or that sort of thing. It's goes way beyond just these simple little things that people throw buzzwords out. It's like, oh, make it socialized. Oh, make it privatized. Oh, like, get the government out of it. Those can certainly play a role, but whenever you fix one variable, other variables will get affected. And it's such a big balancing act, and it's quite complex that I think everybody underappreciates how complex it can get. And not only that, there's an ethical component compared to other businesses. So there's an ethical component of humans, being that, we don't want to die.
Yeah.
We don't want our loved ones to die. And nobody wants to get sick. Nobody wants to see people die. And that makes things a lot more challenging from that point of view. So we are susceptible to a lot of those different forces out there, if you will, when it comes to making healthcare policy and how to manage your own healthcare in general. So yeah, I mean, there's something for everybody to just keep in mind, and we can sort of debate all this kind of ad nauseum, but it's just, there's no real one perfect system out there. I mean, you could say the same thing about economics as well. You can say the same thing about a lot of things. So you're going to have the good and the bad, and we're going to talk about that today. So Zach, from your perspective, let's just you've been in the Canadian healthcare system for your life, essentially. What would be your experiences, good and bad? So talk about both. What are things that you like about it, and what are things you don't like about the Canadian healthcare system?
Well, I guess both especially from personal perspectives, when I go through my own experiences or talking with people who are very close to me, one of the big things I think a lot of people will agree upon, if you have minor injuries, like if you break it, at least from what we understand, if you break an arm, break a leg, things of that nature, you need a cast put on, stuff you might consider is pretty minor, then it's kind of nice to have a bit of that socialized care where you don't have to shell out what maybe a few $100s, again, at least from how we kind of see it looking out. But when it comes to anything really major, especially if you have to go to the emergency room or if you have to wait for any real operations, procedures, or even just to go through CAT scans, MRIs, any of that, then everyone will agree across Canada that the big word to describe it is waiting. You just simply have to wait over and over. And I'm based here in Ontario, where when we look at statistically, we actually have it the best. And a lot of Ontarians, when I tell them that, are shocked to find out that we have it the best for the experiences they typically go through. That as we move out to the East Coast in Canada, as we go to Newfoundland and Labrador, Nova Scotia, there they have it the absolute worst for wait times. And I have some of that data here to go through, where it's absolutely dreadful when you even just get a recommendation from your practitioner how long you have to wait and how much it's gone up over time, where across Canada now and through the median, it's about 30 weeks from your recommendation from your
Oof.
to then get whatever it is that you need to get.
Damn.
And so it's insane. So I think it's about 23, 24 here in Ontario, and it gets up to over a year in some of the provinces on the East Coast.
Yeah, I mean, 30 weeks. Sheesh, that's what we're talking about. 7.5 months. Yeah,
Yeah.
you can have a cancer diagnosis go unchecked for 7.5 months, and it can go from it can advance stages in that time period. So yeah, I mean, that's a bit too long. I mean, you're gonna expect to have some wait times. I mean, it's again like there's no idealized way where you're gonna have almost zero wait times. And in the United States, in the emergency room, we complain about like 1 hour wait times,
Right.
whereas like, I mean, I'll take 1 hour over 30 weeks. My goodness. The other thing that I've noticed about the Canadian system and other socialized systems that are like that is that it's their interpretation of what emergency means, and
Yeah.
that's different depending on the system. But like, what constitutes an emergency though in Canada that would sort of accelerate that timeline?
Yeah, well, it's absolutely everything. That's one of the problems. Again, when you get different people's perspectives and going through different experiences on your own, it's really interesting to see that when I used to work at the Home Depot, one of the customers who'd come in frequently was a doctor at the Mayo Clinic. And he would tell me that, especially going through both systems, he actually preferred the co-pay system of the United States because you didn't have people just coming to our ERs because it's a 24-hour service. Well, especially as you get later into the night when maybe stupid accidents will happen, say if people are drinking, whatever, you don't have any clinics open that you could go in for a walk-in at that point. So you pretty much have to go to the emergency room. And you'll have people flooded in there for all sorts of reasons. They may even just not even something that the doctors can fix. It's just tight. You have to go home and wait it out. It's going to be sore. Like if you've bruised your shoulder or something, it's a really bad one. People will be showing up to the emergency room for absolutely anything. And so unfortunately, again, it's just more waiting in that instance. So I even had one, which is of recent. I was doing a bit of boxing and sparring with my friends. And during our matchup, he threw out his shoulder. And so we thought, okay, we'll get him over to this is probably like 11 o'clock at night or so, get him over to the ER. We weren't drinking at all, nothing in our system. And we thought, okay, we're not going to give him anything before we go. So that way they'll give him something when he's there to dull the pain. And we waited for about 3 to 4 hours in total. And in the entire time, his shoulder was just out of his socket. And the doctor, when we finally got seen after about 3 hours or so, and again, he received no medication during this time. They would not give him any sort of painkiller. So he just sat for 3 hours with his shoulder out of his socket. And we were thinking at this point, you just need a nurse or someone to come in and put it back in because that's all we're looking for just so we can get out. But the doctor even explains, okay, if you want, we can do some MRIs, we can do scans, and we can get you through these procedures to see how bad it is, or we can just pop it back in. But if we go through the scans, again, more waiting, we'll essentially be here all night. And so my buddy Terry just says, no, just put it back in, and had his shoulder put right back in. So for something even as simple as that, unfortunately, you will be waiting forever. And again, that's in Ontario, where it's one of the better hospitals we have even in the province, and one of the better cases, I'm sure. But it's still unfortunate.
Yeah. Here's an interesting thought that I just came up with. I said this on my channel before about the U.S. healthcare system, in that we have so many hospitals that are open.
Yeah.
I'll give you an example of me personally. Like I cut my finger not that long ago, and there was like an urgent care type clinic like a mile down from my house, and I had zero wait time because there's there's plenty of ERs around me. Like the closest ER to me is about 5 miles away, but there's so many of these smaller facilities, and there's also a bunch of ERs in my area. I live in a metroplex, that by default, like that would automatically decrease your wait times because you have more places to go. How would you describe the kind of the density of hospitals in Canada or even Ontario?
Overall, from what I've seen, it's pretty poor, to be honest,
Okay.
that you will have a single hospital covering quite a wide radius of people. And like even for the one week we have here in Newmarket, there's one hospital. Newmarket itself is a town of about 80,000 or so people, and it probably serves as the only hospital within a few towns over. So it would cover a few 100,000 people at least just for one
Yeah.
hospital. And so unfortunately, yeah, you'll have it crowded up. But even in the city of Toronto, I have to double check on this, but I would be surprised if you had more than like 10 hospitals truly through there. I think even for well over 1 million, 2 million people now, it's very limited in what we have. And so unfortunately, wait times are through the wazoo. So even if you want to get like an MRI scan or anything like that, not only are you having to wait 20 weeks, whatever it is, we can go through for depending where you are. That's not like 20 weeks and you're waiting for 3 o'clock in the afternoon. You're going to be going 24/7. So it's at 1 in the morning, at 3 in the morning, whatever. So if you're working as a regular Joe 9 to 5, you're going to have to deal with being up late one night or having to do a full overnight. And it makes it hard for the average person because that's the only appointment that's available. So there's many things with waiting.
Oh yeah, and so I think that's one thing that we tend to forget because we do have a lot of access. Like that's the one nice thing about the U.S. healthcare system. But my caveat with that on this channel that it's also a sign of like how sick we are as
Yeah.
a population. But when you think about those kinds of factors, there's plenty of reasons why any place would be crowded. I mean, when the demand is that high, and especially when you're serving, only a few sites are serving quite a lot of people. I mean, Toronto is not a small city by any stretch of the imagination, and yeah, the fact that that's all you got, makes things a lot more challenging. Not even counting on the actual healthcare system itself, like just the fact that you have so many people so many people to serve per hospital,
Yeah.
that already makes things clouded. So it's something to think about, especially when folks out there that travel a lot, to consider when you're looking at other places to travel or live. Something that I think about when I'm traveling. But yeah, so because of all this, the wait times and the the way the system is in Canada. I'm sure you've seen plenty of this where a lot of Canadians actually cross the border and come to the U.S. for their care. Um, I've seen that. I've had a bunch of colleagues who worked at I think it's U Michigan in Ann Arbor, and that's like, yeah, not too far away from the border, from the Canadian border. It's a very small town in general, but it's basically makes all of its income on healthcare.
Yeah.
And it's like, yeah, it's like one of the places where you would term the Canadian snowboards, or sorry, the Canadian snowbirds would go for healthcare instead of using the Canadian system. So like, I guess, like, I mean, have you seen that a lot? And
Oh
how
yeah.
does that work? How can somebody who's Canadian take advantage of that?
Well, no, it definitely is. It's almost like in some ways a double dip the chip because you have to pay for taxes here to fund the healthcare system that you're not going to use, and have to go down and get your procedure in the States. But yeah, unfortunately, I've known a lot of people who've had to go through that exact situation. Like even a family member of mine had a very serious knee injury where I forget what muscle, but I think it's like his MCL got blown out when he was at work, and so he had to get repaired. And they said again, just to get the proper scans that he'd need before they could even get him his operation, he was going to be waiting, I think it's about 6 months or more before they could properly get him through. And then you have to rehab and do everything after that. And so he just said, like, it sucks, but I could go down to the States and then have it be done in about a week or so, and then I can get to rehab right away because I need to get back to work. But and this is where another thing that comes with anything that's government regulated, you get a lot of who knows who, and with a bit of nepotism, his boss is able to get him through the system, and then he was able to get through the Canadian one ahead of someone else. And that's also something that pervades in a lot of the ER systems or in many different levels of what care you kind of need. If you know the right people, they can pull the right strings to get you through. And that's a whole other situation. But many people do end up going down to the States and saying, okay, I'm going to have to shell out 10,000 or more just to get this operation done. I think that in part leads to the misconception that you have to pay through the nose to the States, when in reality, I know there's complications with insurance for you guys, obviously, but you could just instead be paying the taxes here, pay for insurance, and then your operation be largely covered. And
Oh,
so
so you can pay for U.S. health insurance as a Canadian citizen?
I'm sure you can some way, but my point was there, sorry, is that a lot of people have this idea that you have to pay always out of pocket for US healthcare
Right.
because they're not typically signed up. So even if they have to go get these operations, they're having to pay completely out of pocket for them. But if you were a typical US citizen, you could have some health insurance, so you wouldn't be paying the same price for
Got
these
it.
operations.
I have been doing a little bit more research into this, but travel insurance, you can have travel medical insurance, and actually, in some ways, can be cheaper than actually having U.S. Health insurance. As a way, especially if you live in multiple places outside the U.S., is a good method to have some kind of coverage in if you're in other places. And it's actually like I haven't looked into this deeply, but if anybody in the comments has experience with this, but I'm hearing that it's actually cheaper than the average healthcare in the U.S., um, which is something that I definitely want to look into myself since I'll be traveling quite a lot more in the near future. But um, one thing about you're mentioning out of pocket expenses, so yeah, it could, depending on where you're coming from and what your income is like. I think Canadians are pretty similar in income level versus the US, maybe a little bit less, but not that much. Um, we've found that if it's more preferable to pay out of pocket than to actually even get insurance if you're healthy. I mean, if you're fairly young, you don't have a lot of medical problems, and you're not going to meet your deductible anytime soon, unless you have like an emergency appendectomy or something like that. It's probably better to pay out of pocket anyway. The hospitals and the clinics prefer that because sometimes with some of these payers like Medicare and Medicaid, for example, they'll take themselves like at least a month to get the reimbursements from those insurers, and you're not also guaranteed to get everything that you bill, so to speak. So
Interesting.
there's uh, they would rather take the money up front and then be able to use it so that they can go about their business, and then take a pay cut as a result rather than having to wait for insurance and also not having a better guarantee. It's like, okay, I'm going to at least get you know 30% of what we build so that we can use it to pay the people we need to pay and then keep the lights on.
Yeah.
So it's yeah, that's why I always say, if you're a U.S. citizen, always ask for the cash price. And interestingly enough, with this thing, I asked for the cash price, and then we still ran it through insurance, but I still haven't gotten the bill yet. So I'm waiting to get the bill back to see what happened with this, because so I can tell people about that experience. But maybe they know that I have a channel when I'm actually going to talk about it. They're debating on what to bill me. I like to think I'm that important, but I'm probably not that important. But anyway, so yeah, so that's pretty interesting. Like how the Canadians sort of see um, our side of things, and yeah, I mean, there's also another big thing that we don't think about, because we'd like to think about, I want to live as long as possible, I don't want to die, that kind of thing, but uh, we forget about quality of life.
Yeah.
And if you have a knee injury, if you have a ligament tear like your MCL, for example, that you said, that's going to affect your quality of life. You are less capable of, especially if you're in a job that's like, requires a lot of physical labor, you're not going to be able to do your job as well. You may end up getting paid less. You may not be able to do everyday things around the house very as well. So there is a cost. It's not necessarily of your life. It's more so of your livelihood. And we tend to forget that, as even doctors or even the healthcare system in general tends to forget about that. It's, okay, we kept you alive, but what about, how do I make a living? How do I make money? Like, how do I keep the lights on? That's a really, really important thing. And for a lot of people, more important than just, staying alive. And we do a great job of that, by the way, of keeping people alive. It's just that we kind of leave them broken, if
Yeah.
you will. So it's something that it's hard to measure too. That's the problem. It's kind of hard to measure, and it's kind of hard to get feedback from. And it's, again, this is what makes healthcare so complex, is those factors of like, how do you judge that? How do you judge quality of life when it's not really a quantitative measure? So yeah, it's certainly something that we all should think about. But um, now, correct me if I'm wrong. There is such thing as privatized health insurance in Canada. Is that right?
I believe it's province to province. So some provinces do allow it, but like here in Ontario, we are not allowed to have private care that way.
Oh, it's a law. You can't, like, period
Yeah,
end. You can't.
you can't do
Wow,
that. You can't have private. So yeah,
interesting.
you're gonna have to go to public walk-in clinics, and so that's why to have a family doctor here has become a bit of a luxury because it's very hard to find a family doctor. So for the typical person, you're just gonna have to go to a general walk-in clinic, and basically, again, whatever time of day you're going, you can expect at least an hour wait just to then see the doctor for whatever it is you need to see the doctor for. But yeah,
Yep.
to get an actual family doctor and book an appointment, that's becomes a bit of a luxury, even in, again, Ontario, which is one of the more advanced provinces.
Do you have a family doctor at this point?
I'm lucky that I do. I do have a
Okay.
family doctor. I'm lucky that way, but yeah.
How what's your average appointment time? Or would you like, how long do you like see him or her?
Oh, it wouldn't be that long. Like last one actually it dragged on longer than he would have liked, but it's one of those things I was able to do it over the phone, so I was able to get it within a few days. But if I wanted to go see him in person, then it would probably drag out to be a lot longer.
Okay. But like
Yeah.
I guess like what I'm trying to get at is like,
Oh, the
did
appointment
you get,
itself, like how long?
yeah, the appointment itself, like how long did you have how much time did you have to spend with your doctor?
Oh, normally they want to get in and out, like probably like 10, 15 minutes. They want to get in and out. And that
Yeah.
yeah. It's pretty quick typically. And so even if you're doing like a walk-in clinic with a regular doctor, yeah, they're pretty quick in that sense because they're the line is just so long. They're trying to see as many people as they can, and that's usually the big thing, especially for a big walk-in clinic. You'll be very limited in staff for who they're trying to see. So there's always lines. Like it's known that way. It's stereotype.
Yeah, I would say it's pretty similar, although your first visit is usually the longest. But then afterwards it gets like shorter and shorter, and also more focused on like specific problems, which, there's pluses and minuses to that as well. But yeah, I mean, that's not terribly different than what it is in the US. It's just the way, I guess, the way they sort of work it. It's the subtle nuances of that. But
Yeah.
yeah, you'd expect, uh, probably a 15-minute visit. Yeah, for the most part. Um, and yeah, I would argue that a lot of times for some people, that's not enough time. But it just depends. Um, but yeah, that's interesting that there's like, you can't even have privatized healthcare. Like that's crazy to me. Like, because there, we're talking about people's lives and livelihoods, and you want to give the people as many options as possible, if they can shore up a way to get privatized healthcare, I mean, on their own, I mean, you should be able to let them do that. But the Canadian government always finds a way to make me surprised on these kinds of
Yeah,
things.
like the last election cycle or so, that became a bit of a debate where you had the far leftists saying, no, you need to keep the purely socialist public system and not, because that was the debate. Should they have the two options? Should you have a private option and keep the social option?
Mhm.
And a lot of the far leftists were saying that no, if you have this private option available, all the good doctors and nurses and all that are going to go to the private option. So the social system will be drained. And that was their argument. I think part of the argument, just talking with reality, is that's kind of happening anyways. But instead of going to the Canadian private side, they're just going to the States. And a lot of the nurses that I've dealt with, either their graduate colleagues or themselves, whatever, they plan to just leave our system and go work in a lot of private systems down the States, especially doing like cosmetic surgeries and things like that.
There is a saying out there: you get what you pay for.
Yeah,
I mean,
exactly.
yeah, you're sort of seeing that when it comes to socialized healthcare. Um, that's there's, I
That's
mean,
it.
there's nothing enough said about that.
It's
I mean,
time or money in that instance, and unfortunately, yeah, for a lot of Canadians, like just under a quarter of all our taxes go to this healthcare system,
mm,
and even what is healthcare is expanding much more every day. We're just in the last year or so, we've had now dentistry become socialized, so it's not completely so, but they're making it for if you have a household income under 70 or 80,000, then you'll qualify for socialized dental care. And so again, that means more regulations that dentists have to follow to then meet these qualifications to get their subsidy back.
So are cosmetic procedures a thing in Ontario? Like,
Yeah,
I don't
they
know,
would still be a thing as far as I understand. Yeah.
was that socialized as well?
That would be privatized, but I think that would still be privatized. But I know for things like gender reassignment surgery and all that, that is socially covered as far as I understand it. And I know the city of Toronto is now pushing that they want it to be a benefit for municipal employees. So the umbrella expands more and more every day in that instance. But yeah. So I
Oh
guess what
my
even could be
god.
cosmetic, you can keep making the argument to keep expanding. But yeah.
Yeah, that I guess there's an argument to be made whether gender reassignment surgery is cosmetic or not. Um, yeah, I mean, it kind of is, but I think it's just mutilation. But
No, I completely get you, man. It's
have
just
you
it's
ever seen
painful.
have you ever seen pictures of what that looks like, by the way?
I haven't gone on my way to do that. It hasn't come up my feed, so I
Okay.
don't think I want to see it. I
No, you
think
don't. No, I actually saw one in person when I was in medical school. That I don't know that you can say that that was like one of my red pill defining moments, I guess, where I'm just like, what is going on? And this was back in 20. How old was I? I think this was back when I was a resident, actually. Early residency was 2012. Yeah, I graduated in 12. Yeah, so 2012, 2013. So this is before COVID and when this wasn't really a thing.
yeah.
And I was just like, what? Who signed up for this? Like, this is ridiculous. Like, it's not even just the sites. I'll leave it at this and then we'll move on to another topic because
I
it's going to
get
get
you.
gruesome very quick. I'll say it's not just the sights, it's also the smells. It's not, it was, oh, oh, yeah. I don't know how any surgeon would sign up for that either, but then again, there's a lot of things in life that
Yeah.
just I can't explain, and that's one of them. Anyway, back to back to healthcare in general. Um, yeah, I mean, whenever you and here's a look at an adage, and it's basic economic, and it also applies to healthcare. Is that when you introduce an additional party to the mix to any transaction, so when you introduce a third, fourth, fifth, sixth party to the mix, everything gets more expensive. And this is part of the reason how US healthcare has gotten super expensive because we have so many hands in the pot that are
Yeah.
trying to get their cut, if you will. And unfortunately also the fact that it's extremely complex makes it easier actually for people to get away with these things because it's harder for us to track it down and to crack down on it and know what's actually going on. So it
Yeah.
almost brings up a lot more smoke and mirrors to figure out like, oh, what's really going on behind the scenes, and that's probably also why we don't get as medical students and residents, we don't really get trained on it because the doctors themselves don't really know either. And even me, like for me, like researching it and thinking about it for so long after coming out of training, I still don't know everything that's going on. There's just new things that I'm learning about, like how things work, and unfortunately, it comes in the form of seeing how people are dealing with the healthcare system in real time,
Yeah.
and it's become a really high expenditure also, um, and people are going broke over it too. It's kind of crazy as to think about as well.
Yeah.
So yeah, I mean, it's a more important of a time as any to make yourself healthy enough on your own so that you don't even have to visit a doctor and have to get sucked into this black hole that I call the healthcare system. So yeah, it's we do have a privatized healthcare system, but even that's been sort of tainted in the United States where
Yeah.
it's gotten out of control. Um, and lots of, like I said before, lots of hands in the bucket right now that are trying to like take every penny away from the general citizen.
Yeah.
It's quite something, that's for sure. Yeah.
No, I completely agree. And I think, like you said, even from my own knowledge and research based on the American healthcare system, it's a long progression for state regulation that's consistently grown over time. And really kind of early starts, like we were talking about before when we were leading up to this conversation, was with the FDA being created in 1906. And you get the famous Flexner Report, I believe is in 1910.
Mhm.
And really, probably the big changes came in World War II. And then because of price caps or wage caps, actually, sorry, that the government had then imposed during that time, employers, to try and incentivize employees to come on and work for them, started to offer healthcare as a benefit. And ever since then, it just, like a few other things like tax deductions, things of that nature, just kind of stuck with us over time. And slowly but surely, we started to see more government intervention. So even one of the things that I found crazy, and I was doing a thesis paper and specifically going over the creation of the FDA, is the 6 largest drug manufacturers in America today were all founded before the FDA was created. And so it's things like that we're able to use protection from these government agencies to keep competitors out. And I could be wrong, but I believe today, even still, like it's illegal for Americans to try to buy like Canadian or British insulin and things like that. I find absolutely crazy. Where I'd like to think for a lot of like G7 nations, more advanced nations, we could have a lot more freer trade between what we approve as medicine. So if America or Japan approves, yeah, it's good, then we could be a bit more trusting and say, yeah, it's a good medicine. But unfortunately, there's a lot of private interests, and as government grows, they have their own routes to get in there.
Yeah, it definitely differs amongst country to country and even state to state. Um, there a lot of insurances don't let you go not just out of network, but also they don't let you go out of state to get your health care, which is,
Yeah.
I think is crazy. Especially because I live close to a state border, and we get patients from Oklahoma, our neighbor up north, who come down because they're actually citizens of Texas or they're residents of Texas, and they can't do anything in Oklahoma, or at least or through their insurances. So it's amazing like how restrictive it actually is. It's not like
Yeah.
the health insurance applies everywhere, and that comes with the territory of the fact that the system has just gotten overly complex. And yeah, there's a lot of extra administrative work that needs to be done to like figure all this crap out. And I mean, I didn't know that the 6 big pharmaceutical companies were created before the FDA. Is another, again, this is
Yeah.
stuff that
Crazy
even
stuff.
for me,
Yeah.
it's like I didn't know that. All I knew when I was taught in medical school was like what the drugs were, what they did, and what their side effects were, and all that crap. Like
Yeah.
it was drugs, and this is, I mean, me personally, I think doctors should be a lot more aware of it, but you have to wonder, was it done on purpose to keep
No,
us
exactly.
ignorant, which that's another question for another time. But yeah, it doesn't do anybody, it doesn't help anybody at this point, except for the folks above that are kind of running the show, so to speak. And it's, by the way, it's the people that are running the show are not the doctors, by the way. So keep that in mind as well.
No, that's exactly it, man. Like you said, we all want the same outcome. We all want to get better healthcare for our countrymen, for everyone around us. And so it's just trying to find out what is the best way to do that. And I even think, although I personally believe trying to pursue as much of the private means as you can will bring about the best result, I can also understand the rationalization when pitching to other Canadians. Okay, if we have some kind of a social safety net, how can we do it? And in Canada, when you break down total healthcare spending per person, it comes out to about 5,800, like just under $6,000 a head. And for a family of 4, it's just under $20,000. So it's quite a bit when you think about how much that is year to year, whether you're using the services or not, but just how much of your taxes would be going towards that.
It's 6,000 per year, you said?
Yeah, for the
Okay,
average person, yeah.
that makes more sense. Okay.
And that's why I figure if you want to do it, and like you said, everything's trade-offs where, and even one of my favorite economists, Milton Friedman, talked about this when it comes to how the youth tend to view healthcare, is you're right. You won't be using those services as much in your youth. So you might be willing to risk more and say, I won't get insurance if I have the choice for myself because I think I'll be okay. And it's typically older people who are using those services more, and you've acquired more wealth by that point. And so I think it'd be a lot easier to say that if you want some kind of social system, you could take that money that is spent in taxes and have like an emergency savings account per person made up. So through their 20s, if they're collecting that, say 6,000 or so a year, now you have, by the time you're even 30, 60,000 saved up. Like if you really wanted to try and have some social safety net, you could do some kind of middle ground there that I think would be much better than a lot of the bureaucracy we currently deal with, where you could have a private system, but some safety net in that sense.
Yeah, we do have what's called a health savings account, which sort of explains what you're describing. Is that, yeah, a certain amount gets set aside for health expenditures, so it's not taxed, and you can actually it's usually you have your health savings account with like a financial group like Fidelity, for example, and you can actually invest it.
Yeah, that makes
But
sense.
it's still, you can't exactly take out the money and go buy a Maserati. Like you have to
Yeah, of
you have to
course.
prove that it's a health expenditure at some point. Um, and otherwise you get deductions or you get taxed on it or you get penalized in some way. But yeah, that's one way to do it. But at this point, though, most Americans, just from a general economic standpoint, are living paycheck to paycheck. They
Yeah.
can't even get to this point where they have a health savings account because it either gets drained right away because they have active healthcare expenditures, or they just don't you can't even afford the insurance to even get to that point. So yeah, it's nice to have, but if you can't even put money into it, what's the point? you know, so it's again, it's one of those things. It's just like, did that really help things? I mean, yeah, I don't know about that. Like, it's nice to have if you can afford it, but that goes with anything in life. It's always nice to have if you can afford it, but if you can't afford it, then you're kind of shit out of luck.
No, I get you entirely on that. I guess that's why the larger thought is if you try and cut down bureaucracy in other areas, you could try to shore up those funds for it. The money's being spent anyways in one direction, just put it in a different one.
Yeah.
But yeah, and again, that's as part of a middle ground to try and find for people who insist on having some kind of social care system. That's the best rationalization I can kind of come up with right now. But
Yeah.
personally, yeah, I think to pursue those private ends would be a lot better just for everyone involved.
Yeah. Yeah. Exactly. The other thing that with the US that's definitely different from other countries that I've noticed is we test a lot more.
Oh yeah.
That drives up costs quite a bit. Now, again, this is where we get ethics involved, and it's like, and then we get also legal involved, because we've always had that case where we missed that one like zebra of a diagnosis
Yeah.
because we didn't test for this thing, and we get dinged for it because we missed it, and we missed we either the patient went down a wrong path in treatment, or the patient died, which is
Yeah.
the ultimate thing as a result of the missing something. We get dinged for it pretty hard here. um it's like the saying, the bigger you are, the harder you fall. Like we
Yeah.
get, obviously, the physician salaries in the US are quite high, are probably the highest country wise in the world. So we are susceptible to the law offices out there that are trying to scoop up every buck that they can from us. But
Yeah.
that drives up costs too. We practice a lot of defensive medicine, and could we do a lot more with less? Yes, but right now I think nobody's ready for that, to have that discussion, because we have all had that one time where just like we wish we had done that for some patient, and now we
Yeah.
see a similar patient, we now add on to that laundry list of things to do, and you'd be hard pressed to for anybody to have that discussion, unfortunately, from that
Yeah.
standpoint. So yeah, it's when, and the reason why we, like, I guess other countries can get away with this in terms of like rationing out healthcare is because they have the government on their side, they have the law behind their side on that one, whereas we don't. So there's another caveat to the whole puzzle that is healthcare, is
Yeah.
just the way we practice medicine in general, and kind of the culture of it all. Yeah.
No, 100%. Like you said there's a lot of problems with it. You have to try and do all these different tests for a patient just in case that one could possibly be it, even if you don't think that it very likely is. And it's one of those things that, especially when the lawsuits, and like I said, you have to do defensive medicine as a result. One of the authors I love, Thomas Sowell, had a little short essay on this, and he talks about, I think it's like typically like through English law, but what they should have in the United States is that if the judge looks at this case and says, okay, this is truly a frivolous lawsuit where you're just suing for no reason, then the people suing should have to pay for the actual court trial and everything, because it creates a better incentive to say, if I'm going to sue the doctor or the hospital over this, I better genuinely have a case. I'm not just trying to sue them for the sake of suing them. And you can reduce, at least in part, again, those defensive medicine costs, because it does become a waste. And it's similar things when it comes to issuing drugs. With the costs, if you want to issue a new drug in America, is absolutely insane. They'll get to like the hundreds of millions for testing, for everything. It becomes the same thing. If you're the person having to approve the drug that goes in the market, you're going to take so many defensive precautions, because if that one bad drug gets out there, like a thalidomide incident, you're done, you're cooked, and your career is like, you'll be made the public enemy number one because you allowed this tragedy to take place, because you allowed the medicine to get in the market. But if you then see these other medicines that say, okay, there might be some risk to them, but they could very well help people, you'll just decline them outright. And so that's the part of the risk that comes with it. You might have some good medicines that could serve people that will otherwise never see the market. It's just,
Yeah, and you know, I'm a very uh, kind of uh, a very ambivalent point of view with doctors today, because I can empathize in the sense that, you know, a lot of them just want to do a good job and they want to help people. I truly think that that's still within the minds of most doctors out there.
yeah,
There's obviously the bad apples out there that unfortunately ruin it for the rest of us, um, but the fact of the matter is that, you know, we're sort of pawns in the game rather
yeah,
than the major players, because, you know, we are sort of at mercy of the resources that are available to us. Example of that would be if your health insurance plan covers a generic drug, but it doesn't cover the latest, you know, drug, then the reason why you can't necessarily give that newer drug that could be better for the patient is because the patient may not be able to afford it, and then thus you have to revert back to either the generic drug or whatever that insurance company can cover. So we're sort of, you know, have our hands tied in a lot of things, and,
yeah,
you know, it's nice. Okay, we get tested on this kind of stuff a lot, especially as medical students, but it's a very idealized world. Like in real life, unfortunately, that all that gets thrown out the window.
yeah,
All that logic and reasoning behind, like, you know, oh, like, you know, you shouldn't give this medication for this if this patient has X disease or whatever, blah blah blah. That's more medical talk, but all that goes out the window because of, you know, the way the system works. And uh, we're unfortunately, you know, if you're at least if you're accepting um, insurance in your practice, you're very you have your hands tied in a lot of ways, because you can get things rejected. Also, surgeries can get rejected, for example, and you know, you have to find ways to either, you know, kind of code it correctly, bill it correctly, and if you don't do that well, you know, unfortunately, your practice will sink because you're not getting paid for any of these things
yeah,
that cost a lot of money. So yeah, we unfortunately are susceptible to that. But then there's the flip side of the coin is the doctors out there that have this huge ass ego, and they think like, oh, my way is the way, and, you know, there's no other pathway outside of allopathic medicine that can help you. And if you do anything else, if you try anything else, or if you don't do what I say, then you're just an idiot, and, you know, you get thought less of.
yeah,
Which I don't. That's where I get pissed off. Is like, you know, the doctors who like have the gall to like act like that, and it's usually not in front of the patients. Thankfully, it's not in front of the patients. It's what I hear behind the scenes.
yeah,
Um, when people talk about patients and they talk about it in that sort of way, it's just like, really, like, um, it's you know, it's a little gross from my perspective. And yeah, I mean, it's tough. I mean, for us in a lot of ways. But yeah, we at the end of the day, though, um, we all can choose our pathway and how we want to, you know, direct our lives. You know, and in some ways, people sort of kind of succumb to certain forces out there in one way or another. And the pandemic was a good example of that when it comes to doctors and how they approached that and how they got, sort of what they were able to do and not do, essentially. You know,
yeah,
that was like a big defining moment from that perspective, as to, like, you know, how, you know, how the healthcare system really works, and also like what the actual role of doctors is in this whole
Yeah.
system, and it's not a very big role, to be honest with you. um and so yeah, I mean, we like to use doctors as a scapegoat. I think that's wrong. You have to look beyond that for sure.
No, 100% I get you. And I think, like you said, with the COVID example is a great one to bring up because that was a big issue here at the time where there were nurses who refused to take the vaccine and they ended up getting fired because of it. And it became a huge thing of, again, while we're in the middle of the shortage, while the hospitals are even more flooded than normal, why are we getting rid of these nurses who are perfectly good nurses? And it really was just for a political means to an agenda. And that's part of the scariness of having all these industries regulated and controlled by our government is you're kind of at their whim, where if they want to install these new policies, your job is dependent on having to toe that company line. It's sad, unfortunately.
Yeah, actually, that's an interesting topic. So, I mean, I've talked about how the pandemic panned out in the US quite a bit, but like, what are some things that happened in Canada? I mean, they may be quite similar, but maybe to a different extreme.
Oh
But
yeah.
like, what kind of describe some of the things that happened in Canada that stood out to you that you can remember?
Oh, there's a lot I could talk about because it was during that whole fiasco through COVID that got me into politics and learning about all of this in the first place. And so, with my brother, I ended up finding myself for the first day at the Ottawa protest, the whole trucker protest, and that was going down. So I remember a lot of this period very thoroughly because there's so many things that took place. But one of the big ones, especially, was like I said with the nurses' strike, but especially with the hospitals, is that the mask mandates and vaccine mandates were absolutely insane as they transpired and progressed through Canada. It just slowly started up where, okay, you have to wear masks in schools, you have to wear masks inside, to eventually, I think there were similar policies state by state where they'd have like arrows in the grocery stores or department stores that you go to that you could only walk certain directions down specific aisles. So you couldn't walk back and forth down aisle because they're trying to limit how close you get to people. At one point, they'd put up plastic barriers in the golf carts so that way you could only golf with people who are part of your family, like in your household, and they had to have that plastic barrier in the golf cart. Then in Ontario specifically, we became the only province that actually banned golf outright, where even if you wanted to go golf by yourself
Oh,
outdoors,
jeez.
you couldn't do that. So we got really crazy in many ways. It got insane, but specifically for healthcare, you'd have to wear the mask inside. And I remember my papa was unfortunately in hospital at this point. And where I started to also realize how crazy a lot of this was is you never had to show, at least at this hospital, because it varied hospital by hospital, if you need to show your vaccine passport or not. So some asked for it, some didn't. So it's weird stuff there. By this point, he's at one of the bigger hospitals we have here, South Lake in Newmarket. He's on their palliative care. And once he got moved there, when you would first come in, before he's on palliative, sorry, you'd have to get tested to see, you had to do the rapid test to see if you test positive for COVID. If you're clean, then you go through. For whatever reason, when he got put on palliative care, he's in the exact same room. He's just in a new condition on the chart. We no longer had to be tested for COVID. We could just walk right through with expediency. So we're taking the exact same path to get to the exact same room, but somehow now we no longer had to be tested for COVID. And so there's just so many examples of lunacy that, besides, like, I know many people have made fun of the idea that you had to wear a mask through a restaurant to sit down and then take off your mask. And at one point, we even banned the dining indoors. So we set up, like, during the winter, these tents that were heated outside so people could eat indoors, outdoors. And it's always lunacy in so many ways, whether it's healthcare or other fields. There were so many things that got ridiculous. And it was slowly after the trucker protest that provinces started to wind it down. But we even started to do like sectional lockdowns. So like you would just take one town versus another, and it was the province, like our premier, what would be a state governor controlling it. And they just say, okay, this town has to abide by these guidelines for operating their business, how many people can go in the business, etc. Well, this town can operate these guidelines. And there's a famous photo of two of the different towns in Toronto. I think it's down Yonge Street, where they're technically two different districts, but one street divides them. And the one section was completely locked down with no businesses allowed open, and the other side was completely open. And it's just the typical thing in the US, big box stores allowed to stay open, but small businesses offering the same services, they were shut down. And it all leads to the wealth transfer that happened to that point, which is absolutely atrocious. So the small businesses that were crushed either during that period or because of loans and that whole entrapment that was kind of given out through a honeypot, say, okay, we'll give you a loan to keep you around. But given a few years, many stores just couldn't pay back the loan. So even though COVID's done now, we're still seeing the impacts in many ways around it.
Was there a thing where you needed the vaccine passport to get emergency care?
Uh,
Like you had to get jabbed in order to get emergency care. Was that a thing?
I'm trying to remember. I know that was a debate. I remember the Toronto Star did a famous article saying, should we be denying healthcare to the unvaccinated? That became a huge
Yeah.
point at the time. I forget if it actually went through or not. I think I honestly I don't want to say for sure because I know especially YouTube will spike this up if I get it wrong, but I forget exactly what the policy was. I know it was a huge debate,
Mhm.
but I forget if you need to actually get. I'd lean to unfortunately it was probably that was the
Yeah.
case, but yeah, I
I'm
forget.
sort of with you on that. Yeah, I heard about it, and I was just like, I've heard about in the United States from a different angle. They weren't allowing transplants to happen if you weren't vaccinated, which is I thought was.
Yeah.
I mean, when you get to the actual like science of transplants, like that makes no freaking sense. But anyway, um, yeah. So there was certain. It was not like you just couldn't, you couldn't go to the ER for a broken leg. Like it wasn't
Yeah,
like to
that
that
became a
extent.
serious debate though. Like the Toronto Star is one of our longest run, like biggest newspapers here, not only in Toronto but in the country. And so when they actually ran this serious article, and it's like still a meme online because it was popular, is yeah, should we be denying healthcare to the unvaccinated? That was the larger thing of, and that was part of the pressure is okay, we won't force you to get the vaccine, but you just won't be allowed to do X, Y, and Z. And so even travel became one where, and that was part of the original protest initiative, like for the trucker protest, was banning our restrictions on our freedom of movement because we weren't getting vaccinated. I have to go back to the specifics now, but there's just a lot of stores and businesses that then started to implement based on law saying, okay, you're not allowed to go here and here if you're not vaccinated.
Yeah.
It's if you start, I remember like that was part of my whole issue. As I started to remember more personal stories. If you want to go see a concert or like a sports game, things of that nature, then you'd have to show your vaccine passport, all that, like that you were double jabbed, all that kind of stuff. It got crazy that way. So there was a bunch of places that required it. Just
Yeah. So now that we're in 2025, I mean, from the US standpoint, I read a lot of crazy shit coming from Canada.
yeah.
And obviously we can't trust social media 100%, but from your two eyes and being in Ontario, um what would you say the pulse of the people are right now when it comes to these issues of healthcare and especially like post pandemic, like do people are people you think sort of agreeing with what we're saying right now, or are they still like kind of still sticking with the company line, the party line, so to speak, where they're trying to introduce all these like ridiculous things out there? Like, do the people generally agree with it, you'd say?
I think, unfortunately, I think there's more awakenings happening right now. I don't even think healthcare. Most people know there's a problem with healthcare. They may not know what the next best step is, but they'll at least say, yes, there are problems with our system. But I think there's many more prominent issues, at least from most people's perspectives, regards like the economy in general, housing specific, immigration, things like that are really at the forefront of Canadians' issues for the average person.
Okay.
But when it comes to healthcare, I think a lot of people are starting to wake up now, and that's one of the things that's also going to talk about is how with socialized healthcare, besides the immediate economic issues like we've touched upon that you get with it, now we're starting to see, almost similar to the COVID experience, a lot more like scary Soviet type policies going through or actions being taken. And I was talking about this with a few guys earlier. When it comes to our MAID program, which is our medical assistance in dying, it's become a lot more of a controversy as that's gone on for a few years now, especially as it's recently emerged. Like Jordan Pearson did a bit of a piece on this as to how they're administering like what we want to say, the medicines to eventually put these people to death, and how horrid it actually is to see how this process plays out. What's also happening is we're seeing an increase over the last few years in the amount of organs being harvested from these people to then go over to serve as transplants for people either in Canada or in the United States or other countries, like going to other countries. And so it's become, I think it's CTV News, I had it saved, 15% of the transplants from Quebec, which is again one of our larger provinces, were from these medical assistants and dying patients. And so what's getting very scary, and really is, with this program is a way to cut medical costs, because especially as the economy kind of crumbles in general, we don't have the funds to support a lot of these systems, a lot of our pensions. We're seeing these services, the option to die, being offered to people who would otherwise not need them. And I think that's part of the worry. Like we've had veterans who, like there's a woman famously, I think it's in BC, but she's on the West Coast, who served in the Canadian Armed Forces and was in a wheelchair. And she needed a stair ramp put up into her home just so she can get between the two floors. And they told her outright that we can't install this for you, but we can offer you medical assistance in dying. And so it's things like this that get absolutely absurd. And what's scary when it just comes to how people really are is, yeah, you can get rid of a lot of the people you'd owe pensions to and greater medical services that you've promised by just putting them off. And then, yeah, almost like some people started to comment on with reporting on this issue in general, is it's similar, at least at the sound of it, it's scary with like what the Chinese have done sometimes with like black market harvesting, where you could just have money. If you have people in Canada who need transplants, you can get the organs from them, from the medical assistants and dying patients. And so these are the weird things that are starting to grow within our country in terms of how people are dying with MAID, the reasoning behind it, and how there's eerie similarities with other periods of history with the reasoning behind it, and what we're starting to see grow. It gets really bad. And so that's probably one of the more prominent things starting to come out, is that would be a serious issue, I think, was the whole assistance in dying.
Wow, I haven't thought about the organ transplant topic in a while.
Yeah.
I'll just leave it at this is definitely a Rumble exclusive topic.
I get you.
I'll say this: there's a reason why there's a big market, and we have to be concerned about getting shanked in parts of Latin America because they want our organs. That's like a thing, or
Yeah.
whether it's lore or whether it's real. There's quite a bit of, I guess we'll call it, movement of money going on in that department that or even me, like I had no clue about until I started reading about it. I was like, oh, so some of this is starting to make sense, and it's just like, you have to wonder also, like, why would they push the MAID program to certain populations? It just, you have to. This is where you guys have to. The folks at home, they have to like kind of think outside the box and sort of like what follow the money, and you kind of just visualize like who's benefiting from all this. Like there's usually somebody, a benefactor of some sort, and it's usually not the person that that's written on the bill, like or what it's made out to be. So yeah, that's gosh.
Yeah, it's definitely a big topic to get into, and it's going to be ongoing as we see it develop. But yeah, it's crazy.
Yeah, and we don't, as far as I know, there may be a state out there that allows for physician-assisted suicide. I think there might be 2 states in the U.S. that allows for it. I think it's otherwise illegal. But yeah, I mean, it's definitely not something that we think about here yet.
Yeah.
But I mean, we have skyrocketing chronic disease, but also skyrocketing mental health disease. That could end up, being the end game, is like starting to introduce more of those kinds of things. It's quite a big rabbit hole to go down.
No, that's what gets scary with, and that's part of the rationale. So people who are otherwise not mentally fit or not in their like best state, all these it's always done from an empathetic point of view at first, try and lull you in to say, oh yeah, it makes sense, we feel bad for this person. So you can only do these acts of evil if you feel that you're doing good in doing them, and that's a scary reality. And I think of like the Soviets in a lot of ways, and like even Solzhenitsyn talked about that's exactly how it goes down. And it's just crazy to me. But
yeah, there's I'd like to say that I coined this term, but I think there's a lot of toxic altruism going on, and I think part of the reason why I think doctors are mainly manipulated is because they're manipulating our righteousness and like wanting to help people, to the point where we're sort of leading people down a cliff, and in the name of health, or the name of like oh, we're helping you, that kind of thing. And yeah, I mean that's why I say like healthcare in general is quite complex, because you're adding an ethical component to it, and that just makes things 50 times or more complex. And when you try to come up with ideas for policy, it's not a easy solution at all. And and kind of one of the things that I say on my channel a lot is like the best way to fix it all is to fix the culture. In terms of, and that's not, then by the way, that's not an easy fix.
No,
we've definitely seen it slowly but surely, like sort of getting into this culture rot. And sometimes at some point it's going to get so bad that there's nothing else we could do but swing the pendulum the other way.
Yeah.
That's like our only choice. So I think it's going to get to that point where we have to, where by necessity, like swing the pendulum the other way, somehow. But it's no small feat, that's for sure.
No, that's exactly it, my man. I completely agree with you. I think what you're saying there is a big thing that people can understand as well, is that, well, I know it's a big stereotype for the US in terms of how unhealthy some Americans are, especially the obesity epidemic and things of that nature. And I don't think in many areas Canada is too far off. But I think it's one of the biggest things we can almost try to take away as well for the average person, is that there are larger forces when it comes to the issues of medical care that are out of our control. But what is within our own control is how we can manage our own health. If we can be in shape, we can at least do our best, because nothing's a guarantee in life, but we can do our best to cut down our own medical care costs. And by helping ourselves in that way, we can also help the larger system. And so it's just for everyone that it's if you were to tell people through history, we've gone to this point that even the poorest amongst us are suffering from obesity, people would think of that as a miracle, that you solve famines, now you suffer from obesity. Like, we've turned the tables in a whole new direction, that we just got to find that proper middle ground of having people be in better shape, and whether it's healthy habits, healthy diets, exercise, all this stuff.
We've gotten to the point now where it used to be that worldwide famine was an issue, but
Yeah.
now it's now the opposite. It's
Yeah.
now obesity is a bigger issue than
Yeah.
underweight. And yeah, it's certainly not helping the situation. And again, culture doesn't help either. It's we have all these. I mean, we have RFK. Okay, great. I mean, he's doing okay. He's at least doing better than the previous transgender health person or surgeon general,
Yeah.
whatever he was. At least, yeah, we had something better. But the fact of the matter is that the government's not here to save you. Number one.
No.
Number two, like I bet you there's other forces that we're not aware of that are
100%.
affecting what he's able to do. So we have to take that into consideration. It's not as easy just like, oh, wave the wand and like, oh, okay, we're gonna ban this substance. Like, it's way more complicated than that.
Yeah.
It's fine and dandy, but I mean, there's still quite a long way to go. And I guess like they're trying to dangle the carrot stick in front of us to say like, hey, we're doing something. But
Yeah.
at the end of the day, though, like it's hard to mandate good health care.
Yeah.
And that's why, like you said, it has to come from the individual first before anything else can intervene, so to speak.
No, that's entirely it, my man. I think that's the best way. And again, when it comes to even the regulation of the schools, I personally believe that a lot of that should be deregulating, getting rid of the Department of Education, all that. But I guess while you have the system there, if you're going to use it, you could bring back things like the presidential standards, like fitness tests, where I think stuff like that could be very baseline. Even the larger culture of trying to, I think, enforcing that, yes, especially as young men and women, you should be in shape, that being overweight, especially the point of being obese, is not something to be like proud of or should just be accepted the way it has been. So I was talking about this in my last talk with Canyon, which is a great episode, is how important culture is, especially if my own beliefs in having a freer society and for individual liberty, you need a strong culture backing that, because otherwise it just devolves into chaos. And so,
like, here's something you may not be aware of. So I am an obligate child abuse reporter. So if I see child abuse activity going on in front of my eyes, I am obligated to report it.
yeah.
So here's the fucked up part about this. So I can report when a baby is grossly underweight, right? I can't report, or at least I can report it, but nothing may be done about it, a morbidly obese child. Let that make sense.
Yeah,
Like,
it makes no sense.
it's absolutely child abuse. Like, I don't care
Yeah.
who what how you rationalize it. Yeah, how you rationalize that. I mean, that kid is going to be susceptible to a lot of hormonal changes, metabolic changes that are going to last into adulthood. And yeah, they're kind of screwed at that point, unfortunately. And yes, you can correct it. Yes, you can get them back to a normal weight, but there's already a lot of damage done once you get to that point.
Yeah.
And this is where I'm going to sound like a total jackass, but um, we like to cheer on like folks who lose a lot of weight. That's fantastic. I mean, that I'm not discounting that. Like, yeah, it's a hard thing to do, especially if you're 400 plus pounds and then you get back to a normal weight. You may have to deal with some issues like extra skin and all that crap, but that's fan and dandy. But how about we normalize not getting to that point in the first place? Because
Yes.
even if you get back to that normal weight, you're still going to have some lasting effects of, the hormonal changes, metabolic changes. It's still going to stick with you for probably the rest of your life. That and it's probably going to be even harder to maintain that normal weight
Yeah.
for you, because you've had a set point, if you will, of being much heavier, that what it feels like, and your body can sort of adjust to it, so to speak, easier. This is why you see a lot of folks who get gastric bypass, and a lot of them gain back the weight when they're, when a gastric bypass, by the way, is not a simple surgery. It's you're gutting through a lot of bowel to get to that point, to get it to where it is, and there's obviously complications with the surgery as well. But it's not like a easy thing. It's not like a magical wand kind of thing. And yeah, I mean that's part of it. Like, it's unfortunately, like the reality of it all is that you kind of screwed yourself, and it's going to take a lot more effort for you to be able to get healthy and maintain it as well. So yeah, I mean, I think that we should get to that point, but unfortunately we're dealing with the fact that we have to just kind of get everybody to be less fat in general. That's again, no easy feat, and it's again a big culture shift that needs to happen for sure. Yeah.
No, and you're entirely right. And people can get emotionally outraged if they want to, but what you said there was entirely correct. And especially for the fact that when you look at people who have had to go around the moon, so to speak, where they had to gain a bunch of weight and eventually go on this weight loss journey, they'll be the first to say, just like with any reformed addict, whether it's a drug addict, an alcoholic, a sex addict, even somebody who's reformed coming out of prison, they will share their story saying, don't go through what I went through, learn these lessons, but don't have to go through these pitfalls and hard times. That yes, you want to be in shape, because there's a reason why I changed myself. I didn't like where I was. I went there and I didn't like it. So I had to make a change. So you don't have to go through that same pain and process. Just take care of yourself, be healthy in that sense. And I think that's one of the biggest things that can take away. And like you're saying at the end there too, is with the bypass procedure, and I think many people are trying to take shortcuts now. It's part of the culture we have to hold. Is Ozempic has become a very popular drug. I know it's become popular in the US, but very popular, especially here in Canada too, where a lot of people I know personally have started to take around, like of all ages, as a way to lose weight just through a shortcut. And I find it to be pretty crazy to see how that's becoming normalized in some way.
So Ozempic is covered under the Canadian healthcare system.
I have to double check if it's covered or not, but I do know quite a few people who are using it as a way to lose weight. I'm not recommending it at all. I don't think it's probably a good shortcut, but yeah.
Interesting. Okay. Yeah. That's interesting for me to know, because if they're actually covering it, that's
yeah. I'll double check for you if it's actually covered or not, or if they're doing it privately. But I know a lot of people here are taking it now.
Yeah. If you want to look that up real quick. But anyway, I'll sort of harp on my Ozempic stance. I mean, just like gastric bypass, just like these like quick fixes to get you all to lose weight, you're missing a key component to that journey, and that's it's up here.
Yeah, 100%.
And there's a lot of there's a lot of physical toll, emotional toll that you have to really go through to really let that whole experience stick with you. Much more so. And if you sort of shortcut that process, and make it seem like, oh yeah, if I balloon up to this weight, I can easily just lose the weight if I go back on Ozempic or something like that. And the other part to this that's more obvious is that there's a lot of side effects to these drugs, which we've seen lots of reports on. So there's a bigger side effect component to that. But from the standpoint of not gaining the weight back again, the key component to not gaining the weight back again is if you've went through that process of like tinkering with your diet, tinkering with your exercise routine and your life habits and your lifestyle in general. It's a big lifestyle change. That's what people tend to forget. It's not just what you eat and how much you exercise. It's like how you run your life.
Yeah.
And if you lose that process of like understanding yourself, your body, and the forces around you, Yeah, it's no wonder that we have a lot of relapses once the surgery happens or once you're off Ozempic. It's the recurrence rates are quite high. Um, the biggest thing that from Ozempic, from a medical standpoint, that I worry about is the type of fat that tends to uh, be lost when you're on Ozempic. So there's the fat around your organs, which we call visceral fat, and then there's obviously the your love handles and the fat around your chest wall and abdomen wall. It's We're not necessarily covering the fat around your organs, which is what complicates inflammation in a lot of diseases.
Yeah.
So it's the worst fat, so to speak, is not necessarily being covered by Ozempic. Um, so you could lose the weight, but
Yeah.
the inflammation may still be there, and that could make relapsing into worse health and gain the weight back much easier from that
Yeah.
standpoint. um and yeah, the other thing was there was a question about muscle wasting as well. Obviously, you should be exercising actively on Ozempic, so that does not happen as much, and also your diet needs to be on point as well. But yeah, it's something. Obviously, talk to your doctor about all these plans and blah blah blah. Hashtag this is not medical advice. But it's a nuanced situation for everybody, obviously, and some people that may be their only choice. And what I push on this channel is to not let that happen to you.
Yeah.
We don't want to get to the point where the only way out is a a giant procedure in the hospital. We want to get to the point where you have more options than that, and
Exactly.
also not only that, to be free from a health standpoint, so that you can do what you really want to do in life, travel the world, move freely, do spend time with family. And if you're in bad health, you can't do any of that. And I don't care how much money you have or whatever, it doesn't fucking matter at the end of the day. If your health sucks and you're stuck to a machine or you can't get out of bed, it doesn't fucking matter.
Yeah.
So we, especially nowadays where we're so much in the grind of like trying to make all the money, hustle and all that stuff, a lot of people forget about their health. I think there was a stat recently where like it's extremely rare to have a six pack and I think it's a millionaire. It's like something in like less than 1%, which I believe, like, because it's
Yeah.
really hard to maintain both.
Yeah. I get
Um, like I'm close to one of those. I have one of those goals already checked off, but the other one I'm getting close. But even just getting close is already difficult enough because yeah, I don't have a lot of time to dick around
100%.
and whatnot. So yeah, I mean, it's definitely challenging from that perspective. Were you able to look up the Ozempic thing to see if it's covered
Yeah, I actually
nationally?
do have it. So again, it can vary province by province, but for Ontario, what we call OHIP, it says Ozempic is covered by OHIP for treatment 2 of type 2 diabetes, and
Okay.
coverage for weight loss purposes can vary. So
Okay. So if they guys it under the type 2 diabetes realm, they can get it.
yeah,
Okay.
they get
Interesting.
covered though. Yeah.
Huh. Yeah. Yeah. Yeah, because it's not cheap either. That was the other thing that was on my mind, was that sometimes the socialized healthcare systems don't cover these because of how expensive it could be, but it just depends on how the pharma companies negotiate, I guess,
Yeah.
with the insurance companies. So there's that piece. So yeah, follow the money. There's that piece to it. Um, yeah, I mean yeah, healthcare is complicated. We could talk ad nauseum about this, but yeah, I mean, any last words about kind of what we discussed today? I know we covered quite a bit actually.
No, we actually did go over a lot, and like you said, there's always more to talk about. So I think it's been an absolutely incredible discussion. But there's a lot to go over. And we continue to go over to how medical care has evolved, where we're at now, and where we think it's going to be headed for the future, where we would like to see it be headed. But I think we covered a lot today, man. So I'm really happy with the discussion.
Yeah, and I appreciate you coming on, giving your take from the other side of the border, way up north. And yeah, it's something that we just have to continue to spread the word. Even if it's just to a small amount of people, eventually the word spreads. It's important that you continue to to not give up in that regard, just so that we can make our worlds a little bit better each day. Something that can be challenging, especially when we see all that we see on social media. But yeah, it's we do what we can, and it's and at the end of the day, though, it's really up to you guys as to how you want to manage this information and how you want to go about your lives. So yeah, a lot of points were said today, so appreciate you, Zach, for coming on. For the folks at home, where can the folks find you on the internet?
Thank you for having me on, first of all, Alan. It's been an absolute pleasure. But yes, for the folks at home, you can find me at Perdue's Perspective on Instagram and on YouTube, and you'll find that as well on X or Twitter now. So I'm also doing reels on TikTok, again, also Perdue's Perspective, but the long form content you will find primarily on YouTube.
Yeah, I'm having issues with my TikTok. It's I had the stupidest violations for like the most vanilla of content that I've had. And it's right now for me, TikTok has not been, we're sort of taking a break from TikTok, which I'm not a huge fan of TikTok anyway, so it's already given me cancer. But anyway, but yeah, find me on Instagram, guys, at unplugged.md, and talk to me on X at unplugged_doc. Interestingly enough, Threads may be an interesting place for you to expand, because I get the most traction, but also the most amount of like unhinged comments. It's comical, but also sad at the same time. So if any of y'all want some comic relief, go to my Threads page and you'll see some of the comments there are just like, you either want to facepalm really, really hard, or you want to just have a good laugh. Yeah, that's the place to go for sure, at unplugged.md. But anyways, for those who are watching afterwards, thank you for watching, and there'll be more live streams coming up. And yeah, Zach, we'd love to have you back, or be on your show at some point. And yeah, it's been fun.
100%. Thank you very much, brother.
All right, guys. See you next time. Stay vigilant. Stay unplugged.
Take care.